Hi, my name is Sandra Mason. I'm a nursing student at the University of South Alabama, and today I'll be doing my medication administration checkoff. Here's my ID. Can you scan the room? So the first thing that I would do is to make sure that I am abiding by my agency's policy of a no interruption zone. So that means that the doors to the room will be shut at all times, and also I would not be accepting any phone calls, and any conversations with any colleagues would be kept to important information only. Next thing I would do is go ahead and compare my MAR, which is my medication administration record, with my patient care order form. So when comparing these two documents, you want to make sure that you're using the 5 rights of accuracy. So the first right is the right patient. So we have Jaguar J. Jones, Jaguar J. Jones. Next is the right medication, which is heparin and heparin. Next is the right dose, which is 5,000 units, 5,000 units. And the right route, which is subcutaneously, and the right time, which is every 12 hours and every 12 hours. Next, using these two documents, I want to make sure that, or verify any allergies that the patient may have. So on the MAR, I see that the patient is allergic to penicillin, and on the patient care order form, I see that the patient is allergic to penicillin. Next, I will go ahead and perform hand hygiene before I get started. So the first thing I would do is verify the correct medication. So today I see that I've been ordered to administer 5,000 units of heparin subcutaneously every 12 hours. So I go ahead and find my vial of heparin. So I have a vial of heparin at 10,000 units per milliliter, and the expiration on this vial is 12/5/2025. So this is not expired. The next thing I would do is go ahead and verify the right time. So here on the patient care order form, I see that it's 8 o'clock and that the patient has not been administered any medication. So according to my time, I know that I would now need to give the patient the medication. Next would be the right route. So I see that the patient has been ordered to receive the heparin at 5,000 units subcutaneously. So for a subcutaneous injection, I would use a 1 milliliter tuberculin safety syringe. And next I would verify the correct dose. So since I've been ordered to administer heparin at 5,000 units subcutaneously every 12 hours, I have a vial of 10,000 units per milliliter of heparin. After doing that calculation, I know that I will be administering 0.5 milliliters of heparin to the patient. Next, I'll go ahead and get my medication and my syringe ready. So I will begin by cleaning off the vial of heparin with the alcohol prep pad in a circular motion. I would get my syringe. I would remove the cap and replace it in my sharps container. I would pull up on the safety and pull 0.5 milliliters of air into the vial, or into the syringe. Then I would pull back on my safety and administer the air into the vial. Then I would pull 0.5 milliliters of heparin. I will pull more than 0.5 milliliters just to expel any air bubbles that I have, and then I will correct the dose back to 0.5 milliliters. I'll pull up on the safety and show you that I have 0.5 milliliters of heparin. Next, I will go ahead and verify with another nurse that I have the correct dose of medication that I'm going to administer to my patient. He or she would check my dose and calculations. Next, I would go ahead and make sure that I would assess or verify the medication that I have with the vial and the medication in the syringe to my MAR. So today I've been ordered to give heparin, which is what I have in my vial and what I have in my syringe, at 5,000 units. So I have 10,000 units per milliliter of heparin in my vial and 0.5 milliliters of heparin in my syringe, which is 5,000 units. I will be giving this subcutaneously, which is the right route, every 12 hours, which is the right time. Next, I'll go ahead and make a label for my syringe. So the label will include the patient's name, the medication, and the dose of the medication. So on my MAR, I can see that the patient's name is Jaguar J. Jones. The medication is heparin. And the dose is 5,000 units or 0.5 milliliters. And here's my label. I'll then put my label onto my syringe. Now that I have this syringe that's labeled, I will then get my MAR and I can proceed into my patient's room. So once I get into my patient's room, I will immediately perform hand hygiene. Next, I will go ahead and make sure that the patient is the correct patient by using 2 patient identifiers. So today we have Jaguar J. Jones. His wristband says his date of birth is 8/25/1963, date of birth 8/25/1963, and MR number is 4176352, MR number 4176352. I will also verify that the patient has any allergies. I can see that the wristband says that the patient is allergic to penicillin, and I'll also see that on the MAR form. I would also ask the patient if they have any other allergies that we are not aware of. I would then also do any type of pre-administration assessments to the patient, such as checking their blood pressure or their pulse. The next thing I would go ahead and do is compare my syringe to my MAR using the 5 rights. So today we have the right patient, which is Jaguar J. Jones. We have the right medication, which is heparin. We have the right dose, which is 5,000 units or 0.5 milliliters of heparin. We are doing this injection subcutaneously, and we are doing this injection every 12 hours, which is the right time. So the next thing I would do is come over to the patient and I would just explain the procedure to the patient. I would let him know that he is getting a subcutaneous injection of heparin, and that if he has any discomfort or any questions, just to let me know. Then I would go ahead and raise the patient to a working height. So I would raise the bed up above my waist. Today it's not above my waist, but in a clinical setting it would be. And I would lower the bed rail. The next thing I would do is go ahead and don my sterile gloves, or don my gloves. Okay, now that my gloves are on correctly, I can put on my goggles. So today we will be performing the subcutaneous injection to the abdomen. So when performing this injection, you want to make sure that you go 2 inches from the umbilicus and that you stay within the superior and inferior iliac spine. You also want to make sure you do not go below the pubic region or above the costal margins. Next, I would remove any covering that the patient would have on the abdomen, such as a gown or a bed sheet. Then I would go ahead and clean the area of the abdomen. I would also at this time inspect the skin for any integrity of the muscle or any bruising that the patient may have. And I would go ahead and clean the skin in a circular motion, working my way outward with an alcohol prep pad. And then I would point to the location where the site was cleanest. So next I would go ahead and administer the medication. So since this is a subcutaneous injection and it's on the abdomen, I can pinch the skin 2 inches. So when doing this, I know that I can go at a 90-degree angle with my injection. So I would pull back on the safety of the syringe. I would pinch the skin and I would go in at a 90-degree angle and inject the medication slowly into the patient's abdomen. After this, I would apply pressure, but not massage the patient. And I would also cap my syringe and put it in my sharps container. At this time, I would go ahead and get the patient back into a comfortable position. I would go ahead and lower them back down to the lowest setting for the bed, and I would also raise the bed rails back up. I would then go ahead and dispose of any other syringes that I had or caps that I needed to dispose into my sharps container. Then I would go ahead and remove my gloves. I would remove them glove to glove and skin to skin into my trash can. I would then perform hand hygiene, and I would assess the patient for any allergic reactions they may have. So the next step that I would do is to do the 6th rite, which is documentation. So for this, I would go ahead and document on my MAR the procedure that I did today. So I did a heparin injection of 5,000 units or 0.5 milliliters subcutaneously at the time that I administered that medication. I would also, on that documentation, note any type of pain or discomfort or any type of reaction that my patient had. And if they did have any type of reaction, I would come back to the patient's room at a later time and assess that patient again. Thank you.